Since I'm a urologist and I deal with conditions of the kidney, bladder, prostate, common conditions I treat is kidney tumors, kidney stones, bladder cancers, prostate problems, prostate cancers. So symptoms like for kidney stones, most common symptom would be like somebody with flank pain, blood in the urine. Sometimes they'll come in with they usually come into the emergency room with severe pain, nausea, vomiting, blood in the urine. If we're dealing with prostate issues, sometimes they'll have trouble passing their urine, controlling their urine, blood in the urine. The only way to diagnose prostate cancer is by doing the blood test and exam. But then we also tell them that just because it's abnormal doesn't mean it's cancer. But we have to do a biopsy to find out if there's cancer or not. Because if we don't screen them, a lot of times when we diagnose prostate cancer, it's too late to cure them because they're already spread. And the only way to do that is by doing the PSA blood test. Sometimes they'll come in with problems with ejaculation, like premature ejaculation, but most commonly it's for erectile dysfunction. They are not able to have either not be able to have a normal erection, or they can have the erection, but it doesn't last long enough to be able to have satisfactory sexual intercourse. One thing that has changed our treatment a lot is the discovery of Viagra for erectile dysfunction. This is about 20 years ago. Before that, they did not have that option, and then we would be doing more invasive types of treatments. But with the advent of Viagra and now other pills like Levitra, Cialis, it's a less invasive way of treating erectile dysfunction. And although it doesn't work for everyone, it is definitely the first thing that we go to. The other thing I can think of in urology, and this is not specific to men and women too, with kidney stones. Before, I'd say more than 30 years ago, we had to do open surgery on all kidney stones. Now we have a lot of different equipment available, like we got nice scopes with which we can go in without making incisions and either breaking the stones up with a laser, or we can break up the stones with a shockwave machine. Urologyhealth.org, urologyhealth.org. It's run by the American Urology Association Foundation, and it's meant for urology conditions for the general population to read about it. What are the symptoms? What are the common conditions that urologists treat? And that's a very non-biased, very well researched site.